What's up, guys? Dr. Brett Scott here with Barbell Therapy and Architect Fitness. Today, we want to talk a little bit about how to eliminate low back pain with deadlifting. Now, there's a lot of different things that can happen that can cause back pain with deadlifts, and it's a question we get asked all the time. So there's really no perfect answer to say without a formal evaluation. However, there's a lot of things we can do while deadlifting to help eliminate or at least mediate your pain you're experiencing. So, for one, we need to probably change the variation you're doing currently. So, if you're doing conventional deadlifts and those seem to always be flaring up your low back either during or after or a day later, something probably needs to change. And one of those things we can do is just change the physical stress on the body. So, experimenting with something like a sumo deadlift or trap bar deadlift, Romanian deadlifts, deadlifts from blocks. These are all kind of the first go-tos, especially if you have a meet coming up or some type of test that you're trying to do within a training block. So one thing I will say is temporarily change the variation. Now, if you are traditionally a conventional deadlifter, typically, depending on your body shape, these can put the most amount of physical stress on the low back, where going into something like a sumo deadlift is going to lessen the amount of force that your erectors need to produce and the amount of force on the actual spine so that we don't keep sensitizing it. That's one. We can also experiment with a trap bar deadlift where we really have a lot of variation between something that can look much more like a hinge position and be very low back and hip dominant, or we can kind of turn that into more of a squat pattern. And I like the trap bar a lot as well because it really teaches the individual how to really push through the floor instead of just relying on their low back, especially for beginner lifters. Now, those are some of the first things I'm going to go after when I'm treating someone with low back pain that still wants to deadlift. The other things we're going to look at is consider reducing that range of motion. So like I mentioned, training from blocks. A lot of times, in most cases, the bottom position of lifting the bar off the floor is going to be what's going to cause someone back pain because it requires the most mobility and the most demand on all of the joints through the chain. Now, that's something that's pretty easy, so putting some bumper plates under or some actual training blocks, or doing something similar to a Romanian deadlift where you're not going all the way to the floor. Other things we need to look at when we're deadlifting are our intensity. So if you're training till failure on every set or every rep, that's probably too much, and we can't train in the red zone for that long. So really looking at your training regimen and maybe dialing that back 20-30%, maybe even 50%, depending on how bad your back is, to slowly let the body kind of desensitize from that heavy load, let it recover a little bit more, really take that time in those low intensity ranges to work on technique and getting into positions that aren't so bothersome, and then slowly build that up at 5% per week typically. The other thing we can look at is tempo. So how fast are you doing the deadlift, right? So a lot of times if someone's in back pain, one of the first things we'll start to do is use tempo training. So I'm gonna make someone take 4 seconds to go down. They're gonna come to the point in the range where they're on the threshold right before they start to experience pain. They're gonna hold for 2 seconds, make their way back up over the course of 3 seconds, take a 1 second pause to reset, catch your breath, and come back down. The last part we really need to look at is recovery and frequency. So if you're deadlifting 3 times a week, typically that's going to be too much for most individuals anyways. Deadlifts are a very demanding exercise that take a lot to recover from. So if you're doing that, I would say bring it down to at least twice a week, if not once a week. The other thing we want to look at is total reps and sets. So going by something that some people might be familiar with, known as Prelipin's chart, is a good place to start, although it's not the gold standard. It is something that we can use as a starter point of where your reps and sets should really be And something, if you're training through injury, is something I recommend you follow until we get you out of pain. So looking at reps, sets, and how much volume you have within a workout. And sometimes even if 6 sets is too much to handle in one training session, if that's what you're doing now, see if bringing that down to 3 sets keeps you symptom-free or less symptomatic, and then taking those 6 sets and dispersing them over 2 workouts across the week instead of 1. So those are some of the first things we're going to do when we look at someone's deadlift in our physical therapy clinic. And there's plenty more we would look at too, but those are just some things I would start with that can greatly reduce the way someone experiences low back pain from deadlifts. So if you guys have any questions, feel free to reach out at barbelltherapyandperformance.com or shoot us a message, and check out our new gym, Architect Fitness. Thanks for watching.